صباح الخير. في البداية بحب أشكر دكتور هاني ودكتور أيمن رفاعي على دعوتي النهاردة. ودكتور أيمن طلب مني إنه نتكلم النهاردة على topic exercise and sports after kidney transplantation. وأنا بقالي شوية كده كل شوية باخد مواضيع كلها مش مطروقة ومش مع يعني الريسيرش حتى فيها ما هواش يعني I hope إن إحنا نقدر نوصل مع بعض ل conclusion. So دي أول سلايد عايزة أبتدي بيها، وإنه exercise should be a prescription for patients with all diseases or with various diseases. فالexercise we should prescribe exercise for our patients أي حاجة. Cancer patients, nervous system, metabolic, and of course our kidney patients for the CKD and for the renal transplant patients. Unfortunately, renal transplant recipients have a low physical activity and reduced physical functioning, which is very common among this population. They have a poor cardiometabolic health, which is a very common complication. And the weight gain is very common, especially in the first year following the transplantation. Actually, the problem starts during the early stages of the chronic kidney disease and continues and aggravates with the end-stage renal disease. The low physical activity aggravates the catabolic state that is common in those patients, and the spontaneous recovery of the physical activity and the physical fitness is modest after the renal transplantation. And the low cardiorespiratory fitness and muscle weakness is also common following transplantation. This was a cross-sectional study done by the Canadian على شكل اليوم بتاع ال patients following renal transplantation بيبقى شكله عامل ازاي، ولقوا انه almost 70% من الوقت بتاعهم is sedentary. Sedentary and just reading, watching TV, listening to music، حاجات ما فيهاش حركة، و just maybe 2.5% cycling or doing just moderate exercise. So actually the exercise is very low in this population. And the data shows that the renal transplant recipients, they gain around 5.7 kilograms during the first year of transplantation. And this weight gain is a major trigger for the poor cardiometabolic profile of the renal transplant recipients. This could be part of it due to the dietary prescriptions and dietary styles before the transplantation, and also the glucocorticoids, the steroids used in the prescriptions often promotes the overeating and adds to the problem. And if we assume that the muscle disuse is a major factor in the muscle weakness and the low aerobic capacity in the renal transplant recipients, exercise rehabilitation and increased daily physical activity would be of benefit, and also for those patients to shift from the catabolic to the anabolic states, also the nutrition has to be moderated. So exercise should be a medicine, or is a medicine in the chronic kidney disease prior to the transplantation. Exercise in the chronic kidney disease patients gives them more energy, makes them feel stronger, improve the mood and the quality of life, reduces the stress, and helps sleep and helps digestion, prevents weight gain, improves the cardiometabolic profile, strengthens the heart and the bones, improves the efficiency of the dialysis and makes the patients feel well. But of course, all this has to be under the supervision of the physicians and of the medical staff and the physiotherapists and dedicated personnel. There is a long list of barriers to the exercise for the patients with renal disease, and all this has to be discussed and analyzed with every individual patients. And the most important barriers for those patients is feeling fatigue, the comorbid health conditions, the lack of time or access, fear of falling, maybe due to dizziness or fear of fractures, pain, depression, and many others. In the physical activity in the renal transplant recipient, actually there are relatively low data. Data is not available much about the physical activity in the kidney transplant. It is still less than the general population, but yet it's more than the dialysis population. And of course, the recipient or the other comorbid conditions and psychosocial and socioeconomic factors and long-term immune suppression, this negatively affect the physical activity. And the physical inactivity in the kidney recipient may be associated with reduced quality of life and decreased survival. So it appears, it shows that the exercise is safe in the renal transplant patients, but yet studies with the long-term effects are rare, are not available, and the studies that are available right now are characterized by wide variability in their interventions, and they all have small-sized cohorts. So we need larger studies, and we need studies on the long term after transplantation. So there is the association of the muscle strength, muscle mass, and adiposity with the clinical outcome and quality of life in the prevalent kidney transplant patients has been studied in this prospective longitudinal study. This was on 128 patients, and they checked the low muscle strength by the hand grip strength, the mass by bioimpedance analysis, and both sarcopenia were defined by the lower than the reference cutoffs of the corresponding indices. The sarcopenic obesity was defined as sarcopenia combined with the fulfillment of 2 out of 3 criteria: body mass index more than 30, bioimpedance, derived fat mass, and waist circumference that's more than the World Health cutoffs. And they found that the low muscle strength was independently associated with the composite endpoint of mortality and hospitalization. And the low muscle mass and sarcopenia were associated with physical related low quality of life. Also, in another study of the structured physical activity program on habitual physical activity and body composition, the increased physical activity achieved through structured exercise program induced beneficial effects on metabolic profile and body composition in patients with chronic kidney disease, with even greater benefits in kidney transplant patients. Regarding the cardiovascular risk among the kidney transplants, data were collected from about 4,000 patients, and the physical activity were categorized according to the low, moderate, and high physical activities, and the cardiovascular risk factors were examined among the different groups. And low physical activity group were mostly overweight and obese, and mostly the patients with hypertension and diabetes, and the younger patients, non-diabetics, non-hypertensive, had higher physical activity, and lower physical activity were positively associated with more cardiovascular risk factors. This was a recent meta-analysis a few months ago on the effects of exercise training on cardiovascular risk factors in the kidney transplant recipients. They checked the metabolic profile, the arterial stiffness, the kidney function, body composition, exercise tolerance, and the quality of life. And actually, in those studies, there were not so much significance in the blood pressure or the lipid profile, but there was a significant improvement in the arterial stiffness in this group of patients undergoing exercise in comparison to other controls who are not under exercise programs. And there was an explanation in those. Usually post-transplant patients, especially in the first year, their blood pressure is always well controlled, and they are under strict monitoring. So there was, maybe this would explain the blood pressure and the lipid profile. Kidney function test and the creatinine was better in the exercise group, and of course the exercise tolerance increased and improved in the exercise group of patients. So this shows that there was improved arterial stiffness in this meta-analysis, exercise tolerance, and the quality of life, and did not significantly improve other cardiovascular risk in those group of studies. Exercise increases the nitric oxide production, which will help relaxing the vascular smooth muscle, and it will also decrease the leukocyte adhesion, platelets aggregation, and hence decreasing and lowering inflammation. Also, it could have a potential role in decreasing the sympathetic overactivity in the chronic kidney disease patients, especially in the endurance training like running, jogging, swimming, biking, and all this of high endurance training. Exercise can affect the serum adipokines and markers of inflammations, and this was the change of active energy expenditure, physical activity, adiponectin, leptin, and adipose tissue mass after exercise, and the active energy expenditure increased significantly during 3 months in both renal kidney transplant and CKD patients. The time spent on dialysis or the tolerance was increased, adipose tissue mass decreased, serum leptin decreased, serum adiponectin increased, and the serum CRP levels decreased in both groups after 3 months of exercise. Comparing the aerobic patients who received aerobic training after transplantation or resistance training, and other third group who had were just monitored, the control group, and they checked the pulse wave velocity to see the arterial stiffness of these patients. And this study was on 60 participants, and they were supervised. They had supervised training for 3 times weekly for about 12 weeks. And they divided them into the 3 groups, as we mentioned, and there was a significant improvement in the volume oxygen peak in the aerobic training group, and in the oxygen peak and in the muscle force, especially in the resistance training group compared to the control group or the usual care group after 12 weeks. And there were no reported adverse events or cardiovascular events or hospitalization as a result of this intervention. Those same group of patients, after the 12 weeks, they re-examined them after another 9 months to check if there is a sustained effect of those 12 weeks supervised exercise or not. And actually there was a significant difference or significant improvement still in their and the arterial stiffness existed when comparing especially the resistance group to the usual care group, and the volume of oxygen peak was better in the aerobic group in comparison to the usual care. And so this pilot study suggested that just a motivational interviewing approach combined with appropriate transition to the community training programs could maintain the improvements gained from 12 weeks exercise interventions, and still further research in this area is warranted. And we have to remember that the KDIGO guidelines for the chronic kidney disease, the non-dialysis patient, they recommend that we have to undertake an exercise program that's compatible with the cardiovascular health and tolerance, aiming for at least 30 minutes 5 times per week. So it's part of the guidelines to offer or to motivate the patients to exercise. And the KDUKI guidelines for transplantation, they recommended promoting a healthy lifestyle through weight control, exercise, and smoking cessation that should be a central part of post-transplant counseling and care. And those are some examples from the Cleveland, from Mayo Clinic websites and their recommendations to their post-transplant patients. So they recommend exercise 20 to 30 minutes for the patients. What type of exercise patients should go? The exercise should be divided into 3 basic types, which is the stretching, the cardiovascular, and the aerobic exercise, and the resistance or the strengthening exercise. How often should the patient exercise? 20 to 30 minutes, at least 3 to 4 times a week. And exercising every other day will help you keep a regular exercise schedule. The exercise program should start with a warm-up, and then the conditioning phase, and the intensity, and increasing the intensity and the duration, and patients has to be followed up for the heart rate, and then a cool-down phase before stopping to avoid dizziness or lightheadedness or heart palpitation. Same for the Mayo Clinic, that they recommended once you recover from your transplant surgery, exercise and physical activity should be a regular part of your life to continue improving your overall physical and mental health. في آخر باراجراف إيه هي الexercises they recommended: walking, biking, swimming, low impact strength training, and other physical activities that you do enjoy. And there is the World Transplant Games Federation, and they are responsible for promoting exercise among the post-transplant recipients, and they arrange they have مثلا World Transplant Games in different sites and different locations to recruit and to promote the transplant patients, to engage them into exercising. And this is the world's first transplant football World Cup that will be held next September in Italy. And I will end my talk with this slide, that the prehabilitation of the kidney transplant candidate is it time. So we have to start the prehabilitation for the kidney transplant before transplantation, and we have to start working on promoting exercise and promoting the sports activities for the patients from the early stages of the chronic kidney disease and all through and after reaching transplantation. Thank you.